get fever and headache when we are suffering from dengue.
What is dengue? Anybody else? Okay, I tell you. Dengue is a viral disease. That's the answer. Right? Dengue is a viral disease spread by a virus. Okay. The virus is there inside the mosquito, breeds inside the mosquito, and then it has its life cycle inside the mosquito. Then it bites you, and then it sends virus inside your body. The virus develops inside the blood, and that leads to dengue. There are 4 types of virus, A, B, C, and D. At a time, in one city, there is only one type of virus. You don't get 2 types of virus. Once you get disease with one type of virus, you get a permanent immunity. You don't get that infection anytime in life again. However, you can still get infection with the second virus. Unfortunately, virus in one city and the virus in another city differs. And therefore, if you develop dengue in Ahmedabad, and then you go to Delhi, then you are still likely to get dengue because then there is another virus. So that is as simple as it is. Right? That is about dengue. Yes, it develops by mosquito. Which is the mosquito? Anybody know? Yes.
Female Aedes mosquito breed.
When does it bite you? Which are its good timings?
In the morning maybe, because we have heard that in the morning it bites us because...
So it bites at dusk and dawn.
Yes.
Right? Between 4 and 8 in the morning and 4 and 8 in the evening. That's the time when it bites. Does not mean that mosquitoes have read the books and they know how they are supposed to behave. So it can bite any time. But the commonest time is dusk and dawn. And therefore, you not only to protect yourself in the school, but you require to protect yourself at home because during dusk and dawn you are at home. Okay. What are the symptoms?
The symptoms are headache,
I think most of the things you know, so I am just adding to it.
high-grade fever, muscle pain, body pain, fatigue, rashes,
It is known as petechiae or petechiae. Okay. Petechiae rash.
dehydration.
Why does petechial rashes occur? Okay, we'll go to it later on. The symptoms are fine. Absolutely fine. Symptoms are like any other viral disease. All viral diseases appear the same way. Headache, body ache, joint pain, and high-grade fever. What is the difference of dengue? Dengue is a specific symptom. If it is there with all these things, then you can stamp it out that it is most likely to be dengue, and it is known as periorbital headache. Headache in this area. Periorbital headache is typical of dengue. Right? High-grade fever is there. The fever is around 103 to 104 and it persists for a long time. Okay. What are the complications of dengue? What happens? Suppose the fever is there, then what else can happen? You may not be knowing. Even if you know, I will tell you. There are 3 important complications of dengue. One is swelling or inflammation of gallbladder, which is known as cholecystitis. If you want to write, you can write down. Swelling or inflammation of gallbladder. You may not write the medical terminology, which is cholecystitis. CHOLECYSTIS. CHOLECYSTIS. It is inflammation of gallbladder or swelling of gallbladder. Gallbladder is an organ which is generally below the liver. It stores the bile. Whenever you eat something, bile goes from gallbladder, is pumped from gallbladder to the intestine. That you must have learned in your digestive system. So that gallbladder gets inflamed, and so you get pain in the right below the rib cage, severe pain. It also causes a type of jaundice. Therefore, you develop lack of appetite, nausea, vomiting, all these symptoms. Now the difference between other viruses and dengue is most of the viruses would have fever, joint pain, body ache, even chikungunya virus has the same symptoms. But once the fever is over, the matter is over in all viruses. What are the diseases that are caused by viruses? Name few diseases. Malaria is not caused by virus, it is caused by parasite. Polio, common cold, shardi. It is by influenza virus. Right? Swine flu, it is also a viral disease. Same way, dengue is a viral disease. Chikungunya is a viral disease. These are all viral diseases. We do not have any medicines against viral diseases. Except for swine flu, we don't have any medicines against any viral diseases. So, all viral diseases have same pattern: fever, body ache, and they are all self-limiting. सर्दी के लिए बोलते हैं common cold, if treated, subsides within 7 days. If you do not treat, subsides within 1 week. What does it mean? They are all self-limiting. Dengue is the only option, exception, where you get 3 important complications once the fever is over. And those complications are: one is cholecystitis, that is inflammation of gallbladder, which is common, about 20% of people get it. Number 2 is platelet starts going down. Now platelets are the blood cells that help in Alpa. ત્યારે તારા કામમાં જવું જ જવા રહેશે. હું આ લોકોને લીલું કરી દઈશ, they would meet you after 20 minutes. બસ એટલે 15 મિનિટ પછી મોકલી દે અને you continue with your job.
Okay, sir.
So number 2 is platelets. Now there are 3 types of blood cells: RBCs, red blood cells; WBC, white blood cells; and platelets. Red blood cells, they carry oxygen to different organs. White blood cells, they fight against the diseases, while the platelets help in coagulation of blood. If there is injury, the platelets will go there, stick to there, and would prevent further blood loss. So if platelets go down, there is likelihood of developing bleeding. Now the platelets, normal platelet count is generally 350,000 in our body, 250,000 to 350,000, it varies in legs. In all viral diseases, all including common cold, all viral diseases, platelets go down. But in dengue, they significantly go down, and if they go down below 10,000, normal count is 250,000 to 350,000, they go down to 50,000, 30,000. If they go down below 10,000, then there are likelihood of bleeding. As long as platelets do not go down below 10,000, there is no risk of bleeding. During this episode, this year, this season, we have not seen a single patient going down below 10,000 and nobody has bled. If it goes down below 10,000, if the person bleeds, then you require to replace platelets till it normally achieves it. Because it is a self-limiting disease, it will once again start going up at a time. It could be 5 days, 7 days, 10 days after fever, but generally it starts going up 48 hours after fever goes down. It starts going down immediately once the fever goes down, and starts going up within 2 to 3 days. So those 3 days are very crucial. Which 3 days? Once fever becomes normal. After that, 3 days are important because there is cholecystitis, platelets go down, and that is the time when we have to keep a check on platelets. Unfortunately, what happens is most of our patients, once the fever goes down, they are overconfident. They believe that the things are fine, there are no symptoms. They start moving around, they don't measure their platelets, and that's where every problem starts. So the difference between dengue and other viral diseases is, once fever is down, if I'm going very fast, let me know. Once the fever goes down, all the viral diseases are over. Here, once the fever goes down, then the complications start, which will be there for 3 to 5 days. Number 1, gallbladder; number 2, platelets. We as human beings add to this complication. How do we add? Platelets are generally responsive to non-steroidal anti-inflammatory drug. In short, we call them NSAID. You can write down. Non-steroidal. STEROIDL, non-steroidal anti-inflammatory drugs. The name is very, very big, but it is most of the common drugs that we use. Non-steroidal anti-inflammatory drug. In short, we call them NSAID. NSAID, उसका काम क्या होता है? What do NSAIDs do? NSAID is aspirin is NSAID, Combiflam or Brufen is an NSAID, Voveran is NSAID, and Nimesulide, nice tablet, which is commonly being used for fever, is NSAID. These are all NSAIDs. What do? These NSAIDs, they kill the platelets. Already dengue virus is killing the platelet. These NSAIDs kill the platelet. these NSAIDs are being used for pain and joint pain and fever by most of the doctors. If you take these NSAIDs during this season of dengue, you are likely to get sudden drop in platelets. Even if you don't have dengue, you are likely to get it. With dengue, it can go to dangerous levels and you bleed. That's why government goes on giving lots of advertisement. You have seen that Sanjay Dutt advertisement on TV. You have heard on Mirchi and everywhere, even in newspapers if you are reading. Do not take anything except paracetamol. That is the only safe drug during this season for any fever. Because if it is dengue, then you are likely to develop severe low platelet count. So you are adding to the complication. And that's why you should not take aspirin, you should not take nimesulide, that is nice, combifene, brufen, whatever. So the only safe drug is paracetamol, which is available in the name of Dolo 650 or Crocin or Metafin. If you take this precaution, most of the patients would not have complication. That's number 2. And the third complication is, once the fever is over, 2 or 3 days later, whatever fluid is there inside the blood vessels, it starts traveling to the tissues. From blood vessel to the tissues. And the common two tissues are lungs and abdomen. You don't need to remember all these things. But that leads to dengue shock syndrome. That dengue shock syndrome, there is suddenly fall in blood pressure, edema, fatigue, weakness, breathlessness, all these symptoms occur. This is very rare, less than 1%, but that leads to death, right? So 3 complications: cholecystitis, platelet count goes down, and third thing is dengue shock syndrome, which is very rare. In fact, in Ahmedabad we have only 4 deaths across all hospitals because of dengue, and again all 4 patients were taking NSAIDs, and that has led to dengue shock syndrome. So 3 complications. Presentation we have seen. Which age group it affects? It affects all age group. जिनको भी मच्छर काटते हैं सबको होता है. But surprisingly during this season we have seen mostly kids between 18 to 30 getting affected the most. 18 to 30 in this season. In fact, about 70% of patients are between 18 to 30. We will try to analyze the reasons, and the commonest reason is those who are wearing shorts, up sleeve shorts. This is the group that wears this sort of people. We have seen a lot of patients affected at NID, lot of patients at SEP, because there that is a dress code. वो लोग बच्चियाँ भी shorts पहन के घूमती है. So they are more exposed to mosquitoes, and that's the reason. But maximum affected are there. In fact, surprisingly, we have not seen many complications after the age of 50. Various complications are seen, especially cholecystitis, seen between 18 and 30. Males, females equally affected. Deaths are very rare. So that is all about complications. Then we come to treatment. What is the treatment? As I said, there is no treatment against any viral disease. किसी भी viral disease के सामने कोई treatment नहीं है, except swine flu. So the treatment remains very simple: complete rest. Sure, that doesn't mean bed rest, but don't move around, don't take exertion, don't climb stairs, don't run, don't exert yourself. Number 1. Enough of fluids. By enough of fluids, I mean 20 to 25 glasses of fluid per day. 20 to 20, whatever diet you may take, in addition to that, 20 to 25 glasses of fluid per day. Why do we need fluid? The commonest complication of dengue, platelet, would occur as the blood gets thicker, right? Which we call as hematocrit. That is a part of blood examination. Hematocrit. It shows the thickness of blood. If hematocrit is more than 40, complications are likely. Less than 40, complications are rare. And that hematocrit is maintained by your intake. So, especially during the stage of fever, that is during first 5 days, if you have taken enough fluid and kept your hematocrit below 40, complications are unlikely. So the rest, 20 to 25 glasses of fluid, any fluid would do. दूध, दही, छाछ, कॉफी, लस्सी, नींबू का शरबत, fruit juice, दाल, soup, लिमका, जो भी चाहे. 20 to 25 glasses of fluid per day. Those who cannot take fluid, enough fluid, should be admitted. Otherwise, there is no indication for hospitalization in dengue. The only indication is person who cannot take enough fluid should be admitted. The rest of them should be kept home. So there is no indication of hospitalization. Dengue is not a disease where you should be panicky as long as you can take rest, take enough fluids and get yourself investigated regularly for platelet count, especially after the fever is down. How do you diagnose dengue? Dengue is diagnosed by blood test. There are two types of tests for dengue. One is known as antigen. The virus itself can be detected. That is positive on minute 1. The moment you are having fever because of dengue, the virus will be there. So dengue NS1 antigen, that is the test. Dengue NS capital. NS1 antigen, that's a blood test that would be positive for first 4 days. While dengue IgG, I capital G small g capital, IgG, that is immunoglobulin G, and dengue IgM, I capital G small m capital, antibodies. That is also a blood test that becomes positive after 48 hours but remains positive for 2 weeks. So suppose a patient of fever has come to you after 4 days, NS1 would not help you because it remains only positive for 4 days, then the virus dies. So if the patient comes after 4 days, you have to go for IgG, IgM antibodies. If the patient comes within first 4 days, you have to go for NS1 antigen. Diagnosis, treatment. What do we do if we admit the patient? We don't do anything. We give paracetamol, we give intravenous fluids and rest, and we go for CBC, complete blood count, especially platelet count and hematocrit daily. Once the platelet count starts going up, then the disease is over. Right? So that is about dengue. Now you can have your questions. Whatever you want. Few questions are there here which I will reply. One is, how many people in your hospital are suffering from dengue? At one time, more than 50. At one time. Overall, we have seen around, in this season, hospitalized patient around 360 hospitalized, which means 2 times more OPD patients. So around 1000 patients, out of which 350 have been hospitalized. Okay. Another question is, in which season more number of people are infected by dengue? Obviously during mosquito breeding season, that is monsoon season. But as you know, dengue mosquitoes, that is they grow in fresh water. So if fresh water persists for a long time, the dengue season would be prolonged for a long time. So if you have got area around you wherever there is collection of water, it could be jug, it could be air conditioner, it could be air cooler, it could be the flower pot outside your house. Especially why dengue is more in urban areas rather than in the village area or the rural area. The reason is we have got lots of construction, and the commonest reason why Ahmedabad is affected is construction. Construction area, रोज पानी छिड़कते हैं, वो कलेक्ट होता है और डेंगू वहाँ पर मॉस्किटोज ग्रो होते हैं. So all fresh water collection has to be looked for. So the season is generally rainy season, but it could be in any season. Which medicines are preferred for patients? This has no relevance with the dengue because the answers are generic, regular and other. So it is no relevance. Generic मतलब जो नाम से बनाए जाते हैं. So the answer has to be paracetamol, aspirin or others. Then the answer will be paracetamol. You can change this question if you have framed this. How much time it takes for a person to get rid of dengue? Generally 1 to 2 weeks. How many people this year died due to disease? In Ahmedabad, 4 people. I think the rest of the questions you want to ask to dengue persons, so you can meet them. So you can have questions that you want. Anything and everything you can ask, no issue about it. Yeah.
So why it is so the dengue mosquito bites in early morning?
Dengue mosquitoes are very much sensitive with sunlight. So once the sunlight goes, they they stop and they harbor themselves at a particular place. So, but there is no other reason which scientifically has been found. This is only a possible hypothesis. All over the world, nobody knows why these mosquitoes bite only during this time.
Yeah, I have heard that the mosquito dengue bites below the knees or in the legs. Why it is so?
No, it's not so. Dengue mosquitoes Aedes can fly any height, right? And so people staying on 7th floor are not immune to it. So that is a misbelief. Aedes can fly at any height. However, they cannot fly more than 500 meters. So what you have to do is to keep safety within 500 meters of your residence as far as you want to save yourself. They cannot fly more than 500 meters. How do you protect yourself from mosquitoes? Yeah.
Applying that mosquito repellents or just making the all out on, switching the water.
आप लोगों ने वो बचपन में कहानी सुनी होगी, आपके बच्चे ही है ऐसे, वो कहानी सुनी थी कि एक राजा था, उसको बहुत धूप लग रही थी, तो उसने बोला कि अनफॉर्चुनेटली आप लोग तो पोकेमॉन पढ़ रहे होंगे, तो ये तो पढ़ी ही नहीं होगी, बट देन ही अनाउंस्ड इन द विद इन द पब्लिक कि कोई भी आके सूरज को कवर कर दे. कई लोग आए, बड़ी बड़ी चादर लेके आए, ये वो, सूरज को कवर नहीं हुआ. फिर एक बच्चा आया और उसने कहा कि छाता पहनो, छाता लो. तो दैट इज एग्जैक्टली व्हाट द प्रोटेक्शन टू फ्रॉम मॉस्किटोज इज. प्रोटेक्ट योरसेल्फ. आप वो ऑल आउट लेके बाथरूम में नहीं जाने वाली है, कंपाउंड में नहीं जाने वाली है, बस में नहीं बैठने वाली है. मॉस्किटोज आर एवरीवेयर एंड दैट्स व्हाई 3 important things. Probably the season of dengue is getting over, but still 10-15 days are left. Full sleeve cloth, number 1. Socks in the morning and in the evening, and mosquito repellent. Unfortunately about mosquito repellent, people have limited knowledge. All mosquito repellent, Odomos के नाम से available है. They work only for 8 hours. You have to reapply after 8 hours. Otherwise you are not protecting yourself. आपने सुबह में लगाया, पूरा दिन नहीं चलने वाला है. So 3 things: full sleeves clothes, socks, and mosquito repellent on exposed area except eye and legs. Otherwise सब जगह पे, यहाँ पे कई लोग शरीर पे लगाते हैं, यहाँ नहीं लगाते. मॉस्किटोज आपको आके वहाँ पर भी बैठते. 3 things, remember it next year. The moment monsoon starts, full sleeves clothes. अगर वो नहीं पहन पाते तो socks, upper and lower, and mosquito repellent. Never rely upon all this nonsense. ये सब बिल्कुल फालतू चीज़ है. It is not going to protect you. They have not got long-lasting effect, not more than 2 hours. So always protect yourself other than removing mosquitoes. And of course, remove all the stagnant water from your area. Yes.
So why it is so that they breathe in stagnant and clean water only?
They need oxygen. Clean water gets them oxygen, while the culex or the anopheles, they don't require oxygen. So they grow on the collected water or the dirty water. Because they need glucose. The dirty water is glucose, while these require oxygen to survive and to grow. That's why they grow only on fresh water. Once the water is more than 4 days, it won't grow.
And why does a female mosquito of Aedes breed only creates dengue disease?
Because in males, there are enzymes inside the body which kills it. The females are lacking that enzyme, and that's why they grow inside there.
Means I have heard that when the dengue gets rid, it happens that it starts itching in the body everywhere.
Okay. 2 reasons for itching. One is when platelets go down below 25,000, the capillaries below the skin, they break. That leads to petechiae, the word that you use, petechial hemorrhages. That is because the smaller capillaries below the skin, they bleed. And there are small petechial hemorrhages which are itchy. That's number one. And number two, once the fever goes down and platelets start coming up, at that time there is cholecystitis. Cholecystitis is a sort of jaundice where bilirubin goes up and that causes itching. So itching during fever is because of platelets, itching after fever is because of cholecystitis. There is severe itching.
And how can we identify that it's a dengue mosquito or any other type of mosquito?
There are ways. The Anopheles sits at 45-degree angle with the surface, while dengue sits Aedes sits parallel. It's difficult to do it practically. You cannot go and find out.
Right.
But remember, you have to protect yourself from both. You don't want to do कि dengue नहीं करना है, malaria करना है. So you have to protect yourself from all mosquitoes. And that's another important thing, that Anopheles female bites you at night. So you have to protect yourself throughout the day, right? And remember, as I said, mosquitoes have not read the textbooks. So you cannot argue कि मुझे रात को क्यों काटा. So you have to protect yourself 24 hours a day and protect from all mosquitoes. But yes, for those who are doing epidemiological studies, for them it is important कि ये dengue है या नहीं है. जो लोग prevention measures में लगे हुए हैं, उनके लिए ज़्यादा जरूरी.
In future, is that any reason that the dengue will be eradicated from India?
Sri Lanka is one country which has eradicated malaria completely. Sri Lanka is having lots of forest, very poor economy, very poor educational status, lots of political instability, and it is at least as big as Ahmedabad district, rather 3 times bigger than Ahmedabad district. If they can eradicate malaria, why can't we do it? But that is onto us. Our system does not allow us to do it. We don't have quality control. Municipal corporation does not have manpower, intentions and funds to look for all the new constructions that are causing. Simply if they control all the constructions, they do not allow them to collect the water, then about 80% of dengue problem would be completely gone from Ahmedabad. I cannot say about any other, but in Ahmedabad it is solely because of constructions. I am also practicing in Raipur, which is an area of walled city, which you might not have never gone probably. There is not a single dengue case because there are no mosquitoes, there is no collection of water. The walled city has got probably the best drainage system and minimum construction. It is the constructions that is causing. So simply to protect yourself, if there are constructions around, go to them, request them कि यहाँ पर से पानी हटा दो. We are getting affected. You can do it. But there are possibilities that we can do it. I don't think we will be able to do it, but we should do it. These are all preventable diseases, and we need to protect. We are wasting about 1/4 of our taxpayers' money behind dengue, which is horrible. This is completely preventable.
So,
I thought there are 4 people. It seems there are 2 people only. But आप दोनों सोए? दो ही तरह के लोग क्वेश्चंस नहीं पूछते, या तो जिनको सब कुछ आता है या फिर जिसने कुछ भी नहीं सुना है. I believe आपको सब कुछ आता है.
So I have heard that dengue disease mosquitoes, that reaction, it comes after 13 or 14 days after the virus have entered our body.
After bite, 2nd to 7th day. Once the mosquito bites, the clinical features start from 2nd to 7th day.